that is an area that we focus quite a bit of attention on, is patient safety, risk reduction, liability reduction, things like that. How do we really make better outcomes? Well, certainly by having a physician in-house 24/7, I mean, that's a critical piece of it. You know, most of the liability associated with obstetric care, or certainly a large chunk of it, is related to just the delay of care. When you have somebody in-house 24/7, you know, most of this delay of care goes away. So that's a huge benefit. But more than that, we believe that you need to be proactive when it comes to trying to reduce risk and if you really truly want to improve women's health, you need to be proactive in that. You know, when I was in practice, you know, it was challenging. I mean, you'd be working all day and you'd get home late at night, and you'd finally get some rest, and you'd get phone calls 2 or 3 times, maybe more than that a night. And then after the phone call, after you hung up, you kind of would second guess yourself. Did I make the right decision? Did I tell the right thing? Not only that, you know, the patients remember a different thing. They will say, you know, it's always this he said, she said thing. So what our doctors do very often, the community physicians, when there's a hospitalist program there, will do things a little differently. Oftentimes they will say, you know, they will leave a message. Instead of answering the phone and taking these calls at night, they'll just leave a recording. It says the office is closed. If you feel like you need urgent assistance, either I or one of my associates will be at the hospital 24 hours a day to serve you. That cuts down on all the phone calls, all the unnecessary interruptions of sleep, and it's been a great satisfier for physicians. I think it's safer. I think patients, they can decide for themselves whether, if it's important enough for them to call you at 2 o'clock in the morning, it's probably important enough for them to come in and get checked out. Our doctors, in addition to being board certified, we require them to take extra courses. If you're going to have a doctor in-house 24/7, you really want to make sure that that physician is as close to being an expert in managing obstetric emergencies as you can get. We require them to take advanced fetal monitoring courses, operative delivery courses, shoulder dystocia courses, you know, many additional ongoing courses and trainings to maintain that high level of preparedness. Additionally, our doctors work with the nurses. They do drills, training drills, and unit preparedness to make sure that the labor and delivery unit is the highest level of preparedness for emergencies.